This is What's Up Doc, paid for by Surepoint Emergency Center.
An emergency can happen at any time, but we want to assure you that Surepoint Emergency Centers are ready and prepared to take care of you in any situation. I have Dr. Britt here again with me today to talk about something that happens to all of us. We all know not to play with fire, but sometimes it happens by accident, and boy, does it hurt. Thank you for joining us today.
Thank you for having me. It's a pleasure.
I'm sure burns are pretty common, something you see pretty often in the emergency room, whether it's a kid who didn't know better or an adult who does. Things happen. So talk to me about burns and how we can treat them before we visit the emergency room.
Okay. I appreciate that. One of the unique things here on the Coastal Bend is that people will have a beach fire, and most people are responsible and they will cover the fire, but not that well. So we will see people stepping in the hot fire and getting foot burns.
Yeah.
So that's kind of unique down here. But I just wanted to talk about the three things that we really do for a burn.
Okay.
Now, first of all, any burn you should seek professional help and get it evaluated. But there are three things, I call it the 3 C's. So number one is remove the clothing, and that includes jewelry, rings, watches, necklaces, because there is significant swelling with just about any burn. And if you just wait a short period of time, it'll be difficult to get those things off.
Okay.
The clothing can still be on fire or hot, and so we need to move the clothing.
Okay.
Number two is cool the wound. And the best way to do that is room temperature water or just tap water. So the running water helps with the pain and helps to decrease the progression of the burn. So when we say cool, we mean cool and not ice.
Okay, I have to intervene here. You mentioned a fire on the beach. What if this happens at the beach and the ocean is the first water you think of? Will that irritate the burn?
Yes.
The salt water?
Yes.
No salt water. Had to ask.
That is a great question.
Okay, so that's the second C.
Okay.
What's the third C?
Third C is gentle cleansing.
Okay.
So, and not a lot of perfumes in the soap, just a gentle soap like a Dove soap, and just some running water and some soap just to gently clean the wound.
Yeah, we're not scrubbing it, we're not beating it down. And these are just the primary things you want to do, but we do still encourage you to visit an emergency room in the event of a burn, because like you said, even if you have a high pain tolerance, maybe you think it ain't such a big deal, give it a few minutes and it's going to show you that it means business, right?
Yes, absolutely.
Yeah, and once we get to the emergency room, what kind of care can we expect?
Well, actually, we're going to do the same thing. We're going to do all three of those steps,
Okay.
but we will apply a burn dressing, and that dressing has antibiotics and pain medicine in it. And so we'll debride the wound, meaning we will take away any of the dead tissue, the dead skin, to help prevent infection. So we will treat it with special equipment, special ointments and burn dressings, and then the main thing is we'll evaluate it for how deep the burn is, how significant the burn is, and whether or not we need to transfer you to a burn center or we can just do follow-up visits at the ER for dressing changes.
All right, so fantastic. Although we do have the 3 C's, the important information to care for the burn immediately afterwards, you do want to visit an emergency center like Surepoint to make sure that you're covered to resist any infections or anything like that, or even losing a limb, worst case scenario. Where can we find more information on Surepoint? You have 18 locations.
Yes.
Awesome.
So we have a website, Surepoint.com.
Okay.
And we have facilities in Dallas-Fort Worth, Houston, and here in Corpus.
All right, well, there are so many emergency centers to choose from, but we encourage you to check out Surepoint, and don't forget to tell them